My name is Shelley. I'm a board-certified psychiatric nurse practitioner. I've worked for this organization for over 30 years in multiple different capacities, but as a psychiatric nurse for the past 11. Such a great question, and I want to thank the person that asked that question because it showed care and consideration for another human being, which I think is the answer. When we often wonder what to do if we see someone struggling or in some emotional pain or distress. So the first thing, ask yourself, what would you like to have someone ask you if you were having a difficult time? How would you like to be approached? And then consider that as how you will approach a person. But the walk away with this is please approach and please ask. We oftentimes don't want to ask because we're fearful we're going to make the situation worse or make something happen, and that is so not the case. In the many years that I've worked with folks that have these kind of struggles consistently, I've been told, I'm so grateful someone asked me how I was doing. So the best way to look at that is just to look someone in the eye and be gentle and compassionate and warm and say, it seems like you're having a hard time. Is there anything that I can do? They may not respond well. They may say, nope, there's nothing you need to do. But feel good about what you did. When we have questions on whether we have, like, what's wrong with us? Am I experiencing high anxiety or am I high-strung? Both of them are fairly uncomfortable conditions. But the best way I can define the difference between these two is high-strung is part of your personality. That may have been a way that you have been since you've been a young child. And it is a way that you negotiate your way through the world as far as your personality. High anxiety or anxiety is a diagnosable condition that may need some type of intervention. Interventions can be something like needing to have social support and a friend to talk to, or possibly therapy. It also could require some type of medication management. Anxiety is a condition that many Americans, many Montanans experience. Anxiety comes from multiple different places. It can be generalized to where we feel anxiety more hours of the day and every day of the week than not. People can have an acute stress response. They've had something happen suddenly that was very stressful and they feel a high sense of anxiety related to that. Or they can have anxiety from something like post-traumatic stress disorder. So anxiety is a pretty broad category. And a question to ask yourself is, how much is this interfering in my life, in my ability to live my life? When we look at diagnosing a condition, because we can diagnose all day long, statistics now are saying that 1 in 4 Americans have a diagnosable or diagnosed mental health condition. That doesn't mean that all of those require medical intervention, but the question to ask yourself is, how much is this interfering with my ability to live my life the way I'd like to? This was a really wonderful question regarding therapy. Sometimes I feel like I need therapy, sometimes I don't, and how do I negotiate that? Therapy, or working with a life coach, I'll say both, because therapy can be with someone like me, it can be with a psychiatrist, it can be with a clinical professional counselor, or a licensed clinical social worker, or a PhD psychologist. There's a variety of different people who do different types of therapy, and then life coaches as well. That's a very interesting category. I'd encourage you to look it up. This is a relationship. When you have a tough time in your life and you look at your friend group and you go, what friend am I going to talk to about this? You're going to talk to the friend who likely is the one who understands your story the best, or at least knows your story. And it's very similar for therapy. The folks that I work with in therapy, I know most of their stories, so I have an understanding of where they're coming from and what their struggles are. And that really helps me help them help themselves. So if you are interested in some type of therapy, this would be something you could do. We have many therapists in Great Falls and in Cascade County. Look and see who's there, call them, interview them if possible, see if they have any openings. But just like any good medical provider, it takes time to get in to see them and to establish that relationship. And once you have the relationship established, you don't have to have a weekly or a monthly appointment. You can go to as needed appointments. But one thing to keep in mind about that is if you wait until you're in crisis, it's harder to get you out of crisis. So a good way to think about therapy is helping you with identifying your strengths and identifying what problems may exist in your life and what skills do you have and what skills do you need to acquire. And a trained therapist that knows you and knows your story can help you the best with that. There's a very interesting, at least to me, newer scope of medicine called lifestyle medicine. And I just wanted to share 6 really powerful interventions that you can do every single day to help maintain the best mental health and physical health as possible. And they're pretty simple. This isn't brain surgery. Food is medicine. When you think about what kind of gas you put in your car, think of what kind of fuel you're putting in your body. There are choices of foods that we can make that will help our body run and feel much better. Regular physical exercise. Many of us look at physical exercise as a 4-letter word, and that would be me included. But what I do is I incorporate it in my day-to-day living. So I park as far out in the parking lot as I can to walk in. I use the stairs versus elevators. When I first started doing that, I could only walk up 1 flight of stairs and I was really winded. And now I can run right up 5, and I'm a little short of breath at the top, but it's a practice. But I'm getting in steps and exercise, and it helps my body stay well. Restorative sleep. A very wise sleep medicine doctor said to me years ago, when you sleep, that's when your brain takes out the garbage. And so what happens in your house when you don't take out the garbage? It gets stinky. Our brain gets stinky too if we don't sleep well. So it's important to have as best sleep as you can, and many of us struggle with sleep, so it may be a process. Stress management, toxic stress, those are really words that we throw around every day. Stress is toxic to our body, extreme stress. There is healthy stress. Eustress is called, eustress, eustress, which is I'm going to get up and out of bed today and go to my job, because if I don't go to my job today, I won't have a paycheck to pay my house payment or my rent. That's good stress. But toxic stress is the kind that wears you down, exhausts you, makes it harder for you to sleep. Finding ways to manage stress as best as you can. And that may be where talking to a therapist or life coach will really come in handy. Avoidance of risky substances. There are many legal substances. They are perfectly accessible for persons of certain age to utilize. But keep in mind, moderation is going to be key. For some people, they are able to be moderate, others aren't. Substances can be very difficult on your brain and body. And the final one is positive social connection. We are an incredibly connected world through virtual means. The last few years, through the COVID difficulties we've had, we've moved more to virtual appointments and virtual get-togethers. So we have really disconnected physically even more so. Positive social connection, great research done on that, on how it helps us live longer, live healthier, by simply having good social connection. So those are the summary of things that you can do today to help you stay as healthy and well as possible. When we look at somebody having a tough day to someone who is having a full-blown mental health crisis, there are a variety of different resources. And there are some that are internet-based, and there are phone numbers. And so we know that the standard phone number that we generally call when there's any kind of medical emergency, including a mental health emergency, is 911. When you call 911 for a mental health or a medical emergency, there's something that might be kind of good for you to know. So say if you're calling for yourself or you're calling for a coworker or a friend and 911 needs to be called because it's an emergency. If it's a mental health emergency, there are law enforcement officers that are specially trained. They're called CIT officers, Crisis Intervention Team trained officers. They have an additional 40 hours of training to respond to mental health crisis. There are also in our community a crisis response team of people who are specially trained, licensed professional counselors, licensed clinical social workers that will respond to a mental health crisis. So those may be some folks that will respond to your emergency. But when you're on 911, you can ask for that. There is a Montana text line. You can text on your phone that is that emergency response, and that is 741-741. There's also, we've been so fortunate for many, many years to have an agency here in Great Falls called Voices of Hope, and they reach out to multiple different counties. Voices of Hope is a 24-hour a day, 7-day a week trained, staffed persons. When you call their number and you're in some type of crisis, they are a voice of hope. And if need be, they can also activate emergency medical services if needed. And the Voices of Hope phone number is 406-453-4357. As far as internet-based resources, there are great educational resources. The National Institutes of Mental Health, or SAMHSA, which is Substance Abuse Mental Health Services Agency, is SAMHSA. And then, of course, a consumer-based organization called NAMI, National Association of Mental Illness. Also, within our community, there are a multitude of different types of counselors and private practitioners. Each of them are very good. I'd encourage you to seek out their services if that's what you feel like you need.
Hi, my name is Dr. Angela Casmier. I am the medical director of the Behavioral Health Unit here at Benefis, and I primarily work on the inpatient behavioral health unit. Treatment-resistant depression is fairly common. In fact, it occurs in about 1/3 of those with depression. And what it means is that those folks who have treatment-resistant depression don't respond to optimized treatment with antidepressants. So we're always looking to find other treatments that work, that can be effective for treatment-resistant depression. And Diprivan, which is also called propofol. Diprivan is the brand name for propofol, is a general anesthetic that's been used quite widely for 25 years now in procedural sedations and general anesthesia. And researchers wondered if it might have some antidepressant properties. So they designed a study that is going to collect preliminary data on the feasibility, tolerability, and effectiveness of propofol or Diprivan on treatment-resistant depression. So this study involved only 10 people, and what they found was that it was effective in terms of helping people with treatment-resistant depression. In fact, 6 out of 10 people did have a positive response, which meant that they improved over 50%. And 5 out of those 6 people actually continued to do well 3 months later. The study showed that it is feasible and well tolerated. There were no adverse events in the 10 people, and it suggested, but did not yet prove, that it may work in those with treatment-resistant depression. Because more research is needed to determine the effectiveness of propofol and its mechanism of action, Benefis does not offer Diprivan infusions at this time. Mask anxiety is a very real thing, especially to those with anxiety disorders or a history of claustrophobia. These symptoms of mask anxiety can be overcome with self-directed interventions and or professional help using cognitive behavioral therapy or anti-anxiety medications. So one of the self-directed interventions that you could try is to focus on your breathing. Breathing exercises actually trigger the parasympathetic nervous system, which helps your brain and your body relax and feel calm. One example would be to inhale for 4 seconds, hold your breath for 7 seconds, and then exhale for 8 seconds. And doing this a few times can actually help your anxiety and trigger that parasympathetic nervous system. Another thing you could try is to try different masks, multiple different types of masks, while you're in the comfort of your own home. You'd essentially be desensitizing yourself to the sensation of a mask on your face by trying at small little increments and increasing over time to longer periods of time. You can try different types of masks, such as using a surgical mask that might feel more comfortable than a thicker mask. And then when you go out in public, you're more used to wearing a mask. Another thing you can do is challenge your anxious thoughts. Remind yourself that health professionals have been wearing masks very regularly for over 100 years without any adverse health effects. And finally, you can always get professional help. There are counselors and therapists who can work with you on cognitive behavioral therapy, and there are anti-anxiety medications that could sometimes be tried. ADHD, or attention deficit hyperactivity disorder, is one of the most common neuropsychiatric disorders in childhood and adolescence, and it often persists into adulthood. Many kids who are diagnosed with ADHD continue to meet criteria as adults, but there's a substantial number of adults who are diagnosed with ADHD who did not have it as kids. It can be quite disruptive to one's life and affect occupational, social, and academic functioning. The symptoms of ADHD usually involve inattentiveness, impulsivity, and restlessness. It affects executive functioning and how we regulate our emotions. The first line treatment for ADHD in adults is medications, specifically stimulants or a medication called atomoxetine or Strattera. However, cognitive behavioral therapy can be used in those where medications are contraindicated or for those who want to just have psychotherapy alone. For people who have problems with executive functioning, for adults who have problems with executive functioning, which is a great majority of those with adults with ADHD, both a combination of medications and cognitive behavioral therapy is recommended. Examples of dysfunction with executive functioning include problems with organization and planning, prioritization, time management, completing tasks, focusing on tasks, even starting tasks. And again, this can be quite debilitating to those with ADHD. Cognitive behavioral therapy is a type of therapy that focuses on our thoughts and our behaviors that cause us distress or dysfunction. And so if you were to do cognitive behavioral therapy with a therapist, you would learn skills to address those problems such as learning to use a planner or making lists or a timer. You may get help learning how to prioritize or develop an organizational system like a filing system. There are other types of therapies that can also be helpful, specifically those that address low self-esteem. That is also quite common in those with ADHD. Also, marital therapy can be helpful in working to improve communication, problem solving, and conflict resolution between partners, as well as provide education and support to the spouse of the person with ADHD. Thanks for submitting your questions to us today. If you have any further questions or would like to make an appointment here at Benefis Behavioral Health, you can call 406-455-2367.